and welcome again. Explore Owens session here today. Happy September 1st and welcome back to campus to our students. We're so excited that you're here. But today we are talking with Julie Posey. She is our chair of sonography. We're going to be diving into our Diagnostic Medical Sonography program. Julie, thank you so much for taking time out of the first week of classes to chat with us. That is very nice of you. Thank you.
Sure, no problem.
Can you tell us a little bit about the Diagnostic Medical Sonography program? Just ins and outs, things students should expect.
Sure. So, like she said, this is the Diagnostic Medical Sonography program, better known as ultrasound. I think most people are more familiar with the term ultrasound. In our Diagnostic Medical Sonography program, students would expect to scan abdominal scans, female and male pelvis. We also do small parts. The biggest thing that most people are probably familiar with is OB ultrasound for scanning babies. Everyone thinks that that's all we do, but there's so much more to our program and what we do as far as ultrasound. We are in our lab right now, so these are the machines that students would be using and scanning. We are pretty lucky as far as our field. We are able to practice on each other. The students can come in and actually have a partner and scan and learn here on campus as far as scanning before going out to the clinical site.
Very cool stuff. How long, on average, does it take students to finish the program? I know it's going to be different for everyone depending on your situation, but you know, on average, a couple semesters, 2 to 3 years, what are we looking at?
So our program is set up to be a 2-year program. So we do have some students that come straight out of high school and complete in 2 years. And some students choose to do it within 3 years and kind of take some of their prereqs first and then really focus on the program courses in that 2 years. So I would say 2 to 3 years on average for completing the program.
Cool. What sort of careers in the diagnostic medical sonography field can students expect to be applying for after graduation, or what does their career path look like?
Good question. So most of our students will go on to work in a hospital type of setting. So scanning all of those things that I talked about, from livers to gallbladders, female pelvis, small parts. So most of them do go on to a hospital. But there is that kind of smaller percentage that go on to work in a physician's office for OB scanning or scanning of babies. So, like I said, a lot of people think that that's all we do, but it's actually, you know, a smaller part of what we do. But it is a path that many students do go on to take.
So, Julie, thank you again so much for taking time out of your busy day to talk to us about this program. Julie's going to be joining us again later on this semester, talking to us about another program in sonography. Thanks again so much for joining us. My name's Maddie Harris. I wish you well on your journey. Thanks again, and remember that your success starts right here at Owens.